In this Bites episode, I'm going to show you what I do to get the best results in the Class 4 restoration. Our aim is to have a seamless restoration, a beautiful looking restoration that is invisible to the eye. I use a double bevel technique. So as you can see, there's a 45-degree bevel carried out at the fracture line. And the second bevel is a double bevel. So this is a more infinite bevel. It's a more irregular shaped bevel. And our aim is not to create a straight line. Nature doesn't create straight lines normally, so we want to have a wavy line. We want to have something that's hidden. And what I'm doing here is also cleaning the contact point, ensuring that we have some space to fit our matrices, but also to have a clean margin that's unsupported. I also tend to use air abrasion in practice. This is obviously on a demonstration model, but I would use air abrasion to clean the surface and remove any hypermineralized layer, but also unsupported enamel. We carry out our adhesive procedures. We air thin the bond. This volatilizes the solvents. And here we have a lingual key. This lingual key allows us to copy the previous anatomy, or you may have a diagnostic wax-up of the patient. Our first increment is a very small, a minute amount of the enamel composite. So you can see I've marked where the line of the fracture line is present, of the class 4. We're adapting the enamel composite onto that lingual shell, and you can see how we're now adapting that lingual shell onto the tooth structure. And I'm using a little brush just to adapt that first increment of composite. So we cure our composite, and you can see that first increment that's been placed, a very thin layer of resin that will allow us to adapt around it. Here I'm just removing a little bit of excess, and now we're ready to place our matrix. And in these sorts of cases, it's quite useful to use a sectional matrix, which has a curve similar to that of teeth. There are other different types of matrices that are available. There are many different brands, but quite easy to use one of these sectional matrices. Our next increment is our enamel layer, and what I'm doing here is forming the proximal wall. You can see the adaptation of the peripheral wall. I'm using a very thin flat plastic, and in addition I'm using the brush just to sculpt the resin and adapt that resin really intimately around the tooth. Once you form the wall, you basically have a little window that you can then apply your remaining composite buildup. So our next layer is the dentine composite. And dentine composite's used because it's more opaque in nature. We want to stop light going through the tooth. If we use too translucent a composite in this situation with a class 4, we'd have a dark shadow in that appearance. We'd have this grayness coming through the composite. So the dentine increment allows some opacity and stops light transmitting through the tooth and gives you basically a much more natural appearance. So you can see the adaptation of dentine composite. Always look from the incisor view, as you can see here, to ensure that your increments are the right thickness. You don't want to have your enamel layer too thick, you don't want to have your dentine layer too thick, otherwise the optical properties are going to change and you won't get an aesthetic looking result. I'm using a different instrument. In this case, it's a bit like a PKT type instrument with a sharp point. And this here is just to create some little lobes, some dentine mamelons. Obviously, look at the adjacent teeth. Does the patient need this built into the restoration? Sometimes elderly patients don't have these lobes, whereas a more youthful patient and youthful teeth might have more mamelons and shapes of the teeth and dentine or lobing. So the dentine layer was built. We then have our final layer of enamel, and the enamel being more translucent. Because you have this bevel and this translucency of this final layer of composite, you have this chameleon-like blending of the final restoration. So as you can see, we now adapt, and if possible, I try and adapt this resin with a very minimal excess. We don't want to have a lump of composite that we have to sculpt like Michelangelo. We want to have a tooth that's built up to the right anatomy. So I hope this technique shows you some of the different things we look out for in Class 4 restorations.